Wes here, and today I want to talk about one of the most pressing issues when it comes to our pediatric population, and that's going to be ear infections. Yes, ear infections. It's the number one reason why kids go see the doctor. It's also the number one reason why kids are prescribed antibiotics. Well, did you know that the majority of ear infections are actually viral? The majority of the immune functions actually resides in the gut. Now, what does that chronic antibiotic usage do? Well, it sets these kids up for a weakened gut and a weakened immune system. So oftentimes what we see is that a lot of kids that go through lots of rounds of antibiotics will actually have more immune challenges in the future. And this is what a lot of the research has been showing. And this is what they used to say back in the 1970s when they started to realize that a lot of this antibiotic usage would constantly recur. Now, what exactly is causing all these ear infections? Well, there's two components. There's a plumbing issue and there's an immune system function issue. Talking about the plumbing issue, just like the rest of the plumbing in our body, whether it's esophagus or the blood, we have systems in our body that are designed to be able to pump fluid from one area to another. You don't have blood in your feet because it fell there. Your heart pumped it there. And that's the same exact thing that it happens when we have fluid that builds up in the ear. There's a teeny tiny muscle. It's called the tensor villi palatini. And it actually resides here in the ear canal, which will actually help pump that fluid out of the inner ear and into a different area of the body. Now, what happens when this muscle doesn't function the way it's supposed to is that we have a buildup of that fluid. Now, that buildup of fluid is a breeding ground for bacteria and viruses. And so if we have to make sure that plumbing is working correctly. Now, that muscle, just like every other muscle and gland in the body, is controlled by the brain. And when we go through a rough birth or have birth trauma or we have some type of misalignment in this upper cervical spine, that muscle can be affected. And the communication from the brain telling that muscle to pump that fluid out isn't getting there appropriately. That muscle, since it is attached to so much of the musculature, other musculature, and bones in the top part of the neck, anytime that kid breathes or moves its tongue, it suckles, it's going to help stimulate the pumping of that action. That's why we see a lot of kids that have breastfeeding challenges tend to have ear infection challenges as well. Now, where chiropractic comes in, and especially with our office, is that we have a unique piece of technology in our office that allows us to see where and if the child has misalignment. We can see this non-invasive technology can be used on newborns, it can be used on 2-year-olds, 3-year-olds, even pregnant moms. And so we love using this technology to be able to identify if it's a chiropractic related issue or if it's something that an antibiotic can take care of immediately. Now, talking about the gut and the immune function in the gut, the brain doesn't control just the muscles. It controls other organs and glands. And so oftentimes, if you have a long-term usage of the antibiotics, that normal gut flora, which is a good bacteria that kills that bad bacteria, that's why so much of the immune system resides in the gut. If there's a disruption there at all and the brain can't communicate to say, hey, we need to fix what's going on down here, then we're going to have immune challenges or gut challenges going forward with these kids as well. Now, if this has answered any of your questions or you guys have more questions, that's great. We love answering any parent's questions. Feel free to comment below or even send us a personal message on Facebook or Instagram to be able to answer the questions you guys have. Thank you guys so much, and I look forward to connecting with you soon.